With over 68,000 confirmed cases and over 1,000 deaths, the United States is fast emerging as the new coronavirus hotspot in the world. This is the deadliest day for the U.S., with at least 233 new deaths reported in just the last 24 hours. The U.S. Senate had passed the nation's largest ever rescue package, the crucial $2 trillion coronavirus stimulus bill. The bill now goes to the House of Representatives. This package is crucial to keep the American economy afloat for at least the next 3 months. Just to put these numbers further in perspective, this is twice the annual GDP of countries like Mexico and Indonesia, and around $400 billion more than the GDP of Canada and Russia. Let's take a look at some of the promises made. The first is direct payments to individuals. Single Americans, married couples and parents will receive direct payments. The second measure is the suspension of student payment loans. All payments will be suspended without penalty until the 30th of September. There will also be a historic boost for unemployed people, including giving jobless workers an extra $600 per week for 4 months. The Treasury Department will also provide $500 billion in loans and investments to businesses, states and municipalities. The bill also includes $32 billion as benefits to the already decimated aviation industry. And as a crucial measure, the package will provide around $117 billion to hospitals across the country. The House Speaker, Nancy Pelosi, has called for Democrats to pass the bill and send it over to the president's desk. Meanwhile, President Trump has said that he would immediately sign the package after it is passed in the House. This package is, in fact, a lot larger than the bailout package during the 2008 crisis and will be a major boost to financial markets across the world. On the other hand, President Trump has added that there was no need for countrywide screening for coronavirus, despite a surge in the number of cases. Instead, he praised America's testing measures.
If you take a look at the states, and many states that I'm talking about, they don't have a problem. We have some big problems, but it's confined to certain areas, high-density areas. So why would we test the entire nation, 350 people? With that being said, I'm going to say it again. We tested far more than anybody else. We have the ability to test. I mean, we've come a long way from an obsolete, broken system that I inherited. We have now tested with the best test far more than anybody else. And when I say anybody else, I'm talking about other countries. No country is even close.
This comes as governors of at least 21 states, representing more than half of the American population, have imposed restrictions on movement as more and more states continue to issue stay-at-home orders. The president's wish to open up the country by Easter, which is mid-April, looks like a far-away dream for now. New York, meanwhile, has emerged as the epicenter of the coronavirus outbreak in the U.S. with more than 30,000 cases. It now accounts for nearly half of the total cases in America. This comes as the number of cases in New York rose at an unprecedented rate of 20%. The New York governor has said that there is some evidence to suggest that the density control measures already put in place may be working. According to him, the rate of hospitalizations in New York has slowed down in the recent days, but at the same time, New York has requested for special mortuary teams that are usually deployed for mass casualties. The state also announced new steps aimed at containing the virus. This includes closing some of New York City's streets to vehicles, to allow pedestrians to walk on the streets, to enable greater social distancing.
The plan is going to pilot closing streets in New York City because we have much less traffic in New York City. We have many fewer vehicles in New York City. Open streets. People want to walk. They want to go out and get some air.
On the other hand, the New York City Mayor, Bill de Blasio, warned that half of the city's population might get coronavirus by the time the pandemic runs its course. New York City accounts for most of the cases in the area with more than 18,000 confirmed cases and 200 deaths. The New York City mayor has also hit out at the amount of aid offered to the city, blasting the Senate leadership for the indiscriminate relief.
Giving New York City $1 billion out of a $150 billion pool that they provided for the entire country, but we are 1/3 of the cases in this country right now. Someone do the math down there in Washington in the Senate Republican majority. Someone do the math. They gave us less than 1% of the money that they were giving out to cities and states, and we have 1/3 of the cases in the nation. That is just immoral.
Meanwhile, New York City is currently grappling with the availability of ventilators. Even with new ventilators coming in, the New York City mayor believes that this could still not be enough for the requirement. Tesla CEO Elon Musk has now said that the company's New York factory will reopen exclusively to produce ventilators for the city's requirements. Joining us live at this moment is our correspondent William Deslow from New York. William, hi. The number of cases and deaths in the United States continuing to shoot up. If you can get us a better sense of the latest figures, and President Trump's statements giving out an extremely worrying message that America is not taking the crisis as seriously as it should.
The latest figures coming out of the United States, very troubling indeed. Over 1,000 people in the country have now died from COVID-19. It's understood that around 300 people, according to Wednesday's estimates at least, have died in New York State alone, so well over a quarter. That's incredibly troubling. We've heard from New York's Governor Andrew Cuomo, who says that the problem in the state of New York is 10 times worse than any other state.
Right, we've lost that line with William, but as he was telling us, the numbers have constantly shot up. Over 1,000 people, he says, have lost their lives in the U.S. and the number of cases also going up. New York, like we said, has emerged as the virus hotspot. In New York, more than 30,000 cases have accounted for nearly half of the total cases in the United States. Now, the number of cases in New York specifically has risen at an unprecedented rate of 20%. The New York governor and the officials have at the same time expressed concern over the shortage of supplies on that front. Meanwhile, the U.S. Justice Department has given the go-ahead to use anti-terrorism laws to investigate and prosecute people who attempt or threaten to intentionally infect others with the coronavirus. The law enforcement agencies have made it clear that when such threats or intentional exposures come to light, they are going to enforce the measures. A 50-year-old New Jersey man, George Falcone, has been charged with making terror threats after allegedly coughing in the direction of a local supermarket employee and at the same time claiming that he suffered from the disease. The third-degree terrorism charge carries a sentence of 3 to 5 years in a state prison. Falcone, meanwhile, denies that he has COVID-19 and that he coughed in the direction of the supermarket worker. At the same time, the Justice Department has not made it absolutely clear whether perpetrators must actually have a confirmed COVID-19 diagnosis to be charged with terrorism-related crimes. This development comes as the coronavirus outbreak crisis continues to intensify across the U.S. Over 1,000 people, like we said, have lost their lives. Going back across now to our correspondent, William. Go ahead with the point you were making earlier on, William. And how many of these cases are we looking at? The Justice Department has also not made it clear whether perpetrators must actually have a confirmed COVID-19 diagnosis to be charged with these terror-related crimes.
Yeah, that's absolutely right. These are incredibly troubling figures. And so as saying, the concern here in New York is that we expect cases to really reach ahead in 3 weeks' time. Now, the significance of this, especially when it comes to the opinion from US President Donald Trump, is that he says that it's in really the middle of April, so a similar time frame, that he wants to see the economy back open for business. So certainly seems like there's a contradiction when it comes to opinions on social distancing and just how careful states and the citizens around the country really need to be in the weeks ahead. Of course, there is this strong balancing act that seemingly is going to have to be found when it comes to the economic damage caused by COVID-19 and the public health concerns. So that's certainly that both the federal governments and local governments are going to have to be grappling with in the weeks ahead, especially as well when it comes to potential punitive action to make sure that people are in fact adhering to these guidelines and policies that have now been put in place to try and get COVID-19 under control and to flatten the curve.
Right, and speaking of which, over 3 million Americans, William, have filed for unemployment as the virus, of course, affects businesses and jobs across the country. This is an increase in the rate by more than 4 times. If you can get us a better sense of what measures at the moment we're looking at when it comes to the job sector and the assurances that have been made by the officials.
Absolutely. And just to put that figure into perspective, these are people applying for initial jobless claims, so people going on to the unemployment benefits for the first time. Now, last week it hit 3.3 million people in that region. Now, putting that into perspective, 695,000 was the last record. That was set back in the 1980s. So that just shows the scale of just how big this record has been broken. There are real concerns, some estimates saying that the unemployment rate in the US in the months ahead could reach as high as 30% as COVID-19 continues to take not only a huge toll when it comes to deaths and disruptions to people's lives and health, but also the economic implications as well. Of course, we've seen the Senate pass that $2 trillion spending bill. Now, this includes things like billions of dollars when it comes to some of the major industries that have been hit hardest by COVID-19, looking specifically at things like the airline industry. Also, billions of dollars put into small business loans to try and give those businesses a little bit of helping hand. And another significant part of this bill is that plenty of the funds have been tucked away and will be sent in the form of direct checks into the hands of everyday households in the United States. So that another policy of how the US government is trying to really help mitigate some of these economic impacts. But of course, the real concern is there's very few answers on how long these policies will remain in place. And of course, you might be able to lower interest rates as they are now to near zero. But if people aren't able to go out and spend that money, if restaurants remain closed, bars are closed, you can't go and see your favourite sports team play in stadiums, there are very few options for Americans to put that money back into the economy.
Absolutely, but for the time being, the priority being to save lives and ensure that the restrictions are followed by the people on the ground. We're going to leave it there for the moment. William, thanks very much for those updates and perspectives.